Welcome back to the Rewind Report.
So our last podcast was about skincare, and we kind of want to keep it consistent with the way our consultations go when we're here at Rewind doing our patient consultations. And so usually the thing that comes after skincare is neurotoxin. So today we want to talk about neurotoxin. We're going to get pretty deep into everything neurotoxin, what we love.
Why we do it, how we do it.
How it works.
How often we do it, what kind we use to do it.
Our favorite areas to tox, and all the other things that you may not know that neurotoxins can do.
We do have some surprises for you guys, yeah.
Oh, do we?
Oh, yeah. How about the Nefertiti?
There's a lot, you guys, that we can do with a
guarantee
little.
half of the people watching don't know what a Nefertiti is.
You're probably right. Yes. I think you're correct. Okay,
There's a lot it can do.
Okay, so Court, what is a Nefertiti?
We can't jump into it. We can't give them all the goods right away.
Okay.
Why is neurotoxin next? After we do your consultation, I mean, we cover a lot during a consultation, but when it comes to actually doing the treatment, we've covered your skin, you're ready to go home, you have skincare at home, you have a plan. Why do we want to do tox next?
Because, number one, people's biggest complaint seems to be folds or wrinkles. We like to say folds, but that's pretty simple to fix, and it's like the gateway drug because it's just a pretty quick treatment, and it's long-lasting, and I think they see a big improvement, yeah.
Also, if you remember my analogy from the last podcast, it's like the couch analogy, right? So the first thing is the upholstery. So the upholstery, yes, that's going to be skincare, but it's also going to be neurotoxin.
Yeah.
Because neurotoxin is going to keep your skin free of wrinkles, but it also has a lot of benefits in just like optimizing the skin, making it glow, giving you kind of a
Shrinking
shine.
pores,
Yeah.
controlling sebum. Yeah, you do get a glow once your tox sits in. I like to think about it. A lot of people will come in and they all do this. I want my face to be like this.
Yeah.
Or I want this like this. They all lift up. And even though tox doesn't naturally just lift, and we'll get into what it does, but you can create basically a lift with using neurotoxin. And I think that beyond just treating wrinkles and kind of helping skin quality, you can kind of see a smoother canvas that we then can go forward with like a Sculptra, biostimulant, easy gel filler. But it just repositions all your fat pads like 10 years ago.
Yeah,
and
I think
it's quick and easy, like she said.
It's quick and easy, and I also think fairly inexpensive.
I was going to say that too. Yeah, I think it's
Yeah.
affordable, especially compared to a lot of other treatments that are out there on the market. I think neurotoxin is moderately cheap, and you don't have to do a lot of it to get a good result.
Yeah, and you don't have to wait a long time. With some of the biostimulators, it's a trust the process. You have to wait, 30 days, 90 days. With tox, even though you're not leaving looking automatically improved or having a result right away, it's every tox out there, you're going to see something on day 14.
Absolutely.
Yes, for sure, on day 14.
And the amount of people that come to me after day 14, like, yes, their wrinkles are minimized and they have a little less movement in their forehead, but it's the skin quality is so much better. They really have like a shine, a glow, and anyone who's had Botox can attest to that.
Yes.
Absolutely.
And then they're hooked.
I think a common misconception about Botox, though, is that it only treats wrinkles. And once you get into more advanced injections, you find out that it also can be used to lift, tighten, slim the face.
The pores.
Yeah, even be used to like microneedle or do like little tiny micro injections for skin quality.
Yeah.
So when you learn the basics, back in the day, it's like, okay, how do we do the forehead, the glabella, the crow's? But now we've gotten so advanced. There's so many more things that we can do with it.
So many more things. Traps. That saved me.
Sweating, hyperhidrosis.
Yeah.
Me.
It's crazy.
I don't know if it picks up on camera.
Or even a lip flip. I love doing a lip flip. I think it's a great gateway for people who are a little nervous to do filler and they want to see if they would like having a little bit more volume in the top lip.
Like
Absolutely.
Courtney.
Like me.
like
Busted.
this one.
I know.
How does it work?
Let's talk about, how does it work? So it blocks the acetylcholine receptors. So the muscle is not able to actually contract without getting into a huge chemistry lesson. it blocks the actual enzyme that causes you to contract your forehead or your, I don't know, crow's feet. So your muscle then doesn't get the message to bend or fold. Your muscle doesn't ever move.
Yeah, so it's a botulinum toxin type A is what is in all of them. I know there's a million toxins out there. You have Botox, which has been around forever from Allergan. Dysport been around also forever from Galderma. Now we have Jeuveau, we have Daxxify, we have Zeman, Lativo. So there's a lot out there, but at the end of the day, they're all botulinum toxin type A, so they all work the same, where in your muscle, you have 2 synapses. This is a mini chemistry lesson. Synapses, and when you want to contract your muscle or move something, your brain sends acetylcholine. It floats in the synapse space, while Botox comes and lays right on top of the synapse space and blocks the ability of acetylcholine to tell this guy to move.
Yeah.
That's really what it does.
And basically, if your muscle is not moving, then your skin is also not folding. So if your skin is not folding, then those lines that either you already have are not getting worse, or you're not developing new lines.
Yeah. Think of like a old like love seat recliner that's leather. If you're not going to push the button to recline it or make the cushion move, it's never going to get a wrinkle on it, right? But if you're sitting on it, pushing the recliner in, moving the pillows around, you're going to start develop wrinkles within the leather. It's kind of what Botox does.
I actually have an analogy. Yeah. I know I love my analogies, but I also came up with this one. So if you have a piece of paper and you fold it, you're going to have a crease. Yes. If you fold it over and over and over again, that crease is going to get worse and worse. Now, if you take that paper and you put it in a book and it's stuck flat in that book for 3 to 5 months, depending how long the Botox lasts for you, you take it out, well, it's definitely not going to get worse, and it's going to be a little bit better.
Yeah.
And a lot of times people ask me, well, I don't want to start Botox because I don't want to have to keep getting it, and I don't want it to regress when I don't get it. And the truth is, you're not going to regress. It's just even having 3 months out of your life in that book where the paper's not folding is going to improve. So
absolutely.
Whether you do it once, whether you do it 1 time a year, twice a year, you do it every 3 to 5 months and you never get a wrinkle, that's great. But you're never going to go backwards. You're always going to go forwards when it comes to Botox.
Which I was going to say, the second benefit is muscle atrophy. So the 11s, right in between, for layman's terms, right in between your eyebrows, it can start out really like a large, I call it a tiny bicep in the face. So imagine if you didn't move your arm for 3 to 6 months, your bicep will shrink. Well, same with all the muscles in your face. So if you keep them still, the longer you keep them still, they'll shrink, and then pretty soon
you have less.
And a lot of people have a really large muscles in their glabella, and that's something they don't like.
Yeah.
Or the masseters. I mean, that's another thing to get into. I mean, this is getting a little bit more into the advanced injections, but a lot of people have a more square face or a round face, specifically women who don't want that. Now, if you're a man, you want a more masculine look, a squared face is going to be good. But for women who have more of a squared face, you can actually inject the masseter muscle, and it will atrophy the muscle. It'll stop it from moving.
Atrophy just means it shrinks.
Yes.
Yeah, just like if you broke your leg, right, and you don't move your leg for a couple months, it's going to get smaller. So same thing with your masseter muscles, and over time, you're going to look in the mirror and be like, wow, my face is a lot slimmer. I haven't lost any weight, but my face is slimmer. My cheekbones are a little bit more prominent, and it looks more heart-shaped, which is, in our world, a little bit more feminine. It's a little bit more youthful. Yeah.
Yeah, absolutely.
Yeah. Same with your traps.
And then there's also the benefit of the TMJ. I mean, we've got lots of patients, no aesthetics aside, who just say, hey, my jaw clenches all the time. I wake up, I'm in pain, I'm uncomfortable. Yeah. That's a great option, too.
Or they grind at night.
Yeah.
And they wake up with a headache. Yeah.
Yeah.
Yes. So what else
How about the Nefertiti? Is it time to share the
I think before
secret?
we go to Nefertiti, let's cover something that's like all over Instagram, all over TikTok. And it's this term, and we use it a lot. It's not new, but it's new to the influencers of the world, and it's called baby Botox. Oh, yeah. So what's baby Botox, and why would we choose to do baby Botox on somebody, and what's like the dose range?
So baby Botox to me in my brain means like for a 19-year-old that comes in, they want preventative Botox. Botox, and we're just going to do
I think
very
19's
minimal.
a little too young.
No, I have.
Okay, well,
We
yeah,
have them, but
we'll
we
just
don't
say-
usually
yeah.
recommend that.
Right,
Yeah.
no,
I think
Yeah.
I think take age out of it. Baby Botox is for a first timer. Baby Botox is for somebody who's never had neurotoxin before, and you don't want to load them up with a ton of units because you just want to introduce to them the feeling of what a neurotoxin is in the face.
Without scaring them or making them feel uncomfortable.
Yeah.
Claustrophobic.
Yeah,
Yeah.
so I always tell clients, especially if it's their first time, let's start conservative. Let's do a lower dose than probably what your muscle needs for like a traditional appointment, just so that we can introduce to you this feeling. And the big key and rule with toxins is you can always add more. I can't take away. So
That's a rule for a lot of things.
a lot of things,
Yeah.
but I'd rather start you off with 10 units in your forehead and 12 units in your glabella, maybe a sprinkle in your crow's feet, and let you just ease into what it feels like to not be able to move your eyebrows for a couple months. And if you come back,
Or eyebrow restriction, right? Not being able to move them, but being
but
able
the
to move them
feeling
less
of all
than
of a
before.
sudden you can't make a
Yeah.
full expression. Yeah,
Yeah.
it's something you should get used to. And we always do follow-ups at 2 weeks. Like I said earlier, it takes about 14 days for almost every tox out there on the market to fully set in. And at that 14-day mark, if you're like, hey, I still have this little wrinkle, I love what it's doing, I'm okay to add more, that's the time you would add more.
Yeah, and with that being said as well, we have different neurotoxins on the market, and as a practice, we buy different types of neurotoxins because we like having different tools in our toolbox. So someone who comes in and says, I've been getting Botox for years, I love being frozen, or I want maximum lift, there's a certain product that we would choose for that versus someone who comes in and says, I'm a little nervous, I want super, super natural, I want to barely be able to tell. Or someone who says, hey, I'm an actress and I make my money off of making expressions.
Right.
So
But
dosage,
still wants to be preventative and
yes, and not let her wrinkles get worse. And so yes, there's baby Botox, there's smaller doses, and even going beyond that, there's product choice. And if you are going to a provider who is familiar with multiple products, it's nice because you can decide what's best for that patient.
Yeah, it's not one size fits all.
Yeah.
And to be very clear, I do not encourage 19-year-olds to get Botox. But in the influencer world, they do come in. And then
Yeah.
I talk them down, and I'll do like 6 in their glabella and maybe 6 in their forehead.
or just
Tiny little bit.
give them some skincare and say it might not be time yet.
Well, yeah.
When did you get Botox? How old were you?
I think I was like 35, so 2 years ago?
I think I was.
No. Like 17 years ago is when I got my first
She's our
injection.
walking billboard.
She is our walking.
And I loved it. I loved it. And the good thing is the first time you get it, because your body doesn't know what it is, it lasts like a long time. I don't want to put a timestamp on it, but it lasts a long time. So then I was getting it like twice a year. In my 40s, I was probably 3 times a year, and now a little bit more.
Yeah, I think I was like 25 or 26, and I definitely did the baby Botox thing, and it did last a long time. Where I wore it out. Like I let it completely wear off, and then started realizing when I was doing my makeup, and I saw things were creasing, or I saw photos, and I was like, "Dang, it's time."
I think I have both of you beat because I was 22 when I started mine.
See, someone did baby Botox.
But I'll say it's because I was working in the industry. I was
Yeah.
already injecting people, and when you do something to other people, you want to know what it feels like so you
Yeah.
can, be a better injector. So at 22 is when I had my first injections. Definitely baby Botox. But I think still it lasts a long time. Like, when did we do mine last? I think we did it
It's a while
6 weeks
ago.
before my sister's wedding. So that was
August? July or August.
And I mean, and it's still,
It looks good.
yeah.
You do very minimal.
Yeah, exactly. So a
Yeah.
lot of people, it lasts a long time. We always tell people 3 months just to set expectations, but most people it lasts longer.
Yeah.
Yeah. And I think because I've experienced this with clients where they've come in and they're like, well, my friend got like 20 units in this area and got 16 units, and they're telling me all these numbers. And I'm like, well, your friend probably has different muscles than you, and we do have to.
Metabolism, different metabolism. metabolism.
That too, but your units is based off what we see when you make an expression. It's not necessarily a cookie cutter prescription dose like an antibiotic would be. It's very customizable, and like all three of us here on this couch have very different units.
Yeah.
Courtney probably has the least. The less. Actually, we just did your masseters, so you might be up there with
yeah,
me.
that's true. Yeah, I did masseters for the first time.
And I did traps because I used to be a competitive swimmer for like 9 years, so I was getting migraines because I had large traps, and I would carry my stress like this. I would catch myself driving like this, just stressed out. So
Why do I feel like that's me all the time?
I know. I'm like,
I always had to remind myself to relax, but now Megan injected my traps, not even with a lot.
no, we were just at Disneyland, and she was like, I couldn't even be tense on the ride. She was like, it was so relaxed, I was worried my head was going to fall off.
Oh, yeah, that was
The Matterhorn.
Me next, please.
I know, it was so nice because I don't get any neck aches or back aches anymore, or migraines. I was getting back of my head migraines.
Yeah.
So now I'll do that all the time, probably.
Yeah.
I didn't know it was so great.
Another thing I love for
Right.
Botox too, especially with like beginners or people who don't want a lot, is a little brow lift. Like a little brow lift can go so far, and it's like not a lot of units. I mean,
No.
say you have the 19-year-old who comes in and they want it, they're not going to leave without it. That's a little something you can do to just make them feel a little refreshed and
A little hit.
without doing everything else. Yeah.
Yeah.
I think it's
Absolutely.
got it, yeah. So now, Courtney, because jawline, just here's a little background. So I love jawlines. I think that they're very classy, and I think they look amazing on male and female. Like, that's why our silhouette back here is a jawline, because I love jawlines. And Courtney, tell them about your Nefertiti necklace.
Yeah, so this is usually the big shocker to people because no one thinks that Botox can actually tighten up this area. And I would say so many of my patients come in and they're like, kind of like what you were saying, like lift here. Well, everyone wants to lift here. Like nobody wants jowls. Everyone wants to lift here. And what you can do is actually inject Botox in these bands in your neck and then along your jawline here. Basically, these bands are called your platysmal bands. They turn into a sheath here on the jawline. And so when you inject the bands and along the jaw, it actually releases tension because these muscles pull downwards.
They're depressors.
They're depressors,
Depressors.
yeah. So any muscle in the face that naturally pulls down, like for example, your glabella or your crow's, like they all go downwards. If you inject that with Botox, it's going to give you the reverse. It's going to lift. So it releases the downward tension. It tightens everything here. And then what I love to show people in their before and afters is the pop they get in their cheeks from it, because you've got all these muscles in your cheeks that are pulling upwards.
They're elevators.
Elevators. Yep. And then
Levators.
the muscles down here that are pulling downwards. Well, when you weaken them, naturally these are going to get more of a lift. And so when I show them their pictures side by side, it's like incredible. You see a reduction in jowl. You see a sharpening of the jawline,
A fuller mid-face.
fuller midface, pop in the
Tear
cheeks.
troughs.
Yeah,
I always
everything
tell
just
people
looks
that
better.
want to do tear troughs right away. I'm like, let's try the Nefertiti neck lift, because then once there's no opposition, because these pull down, your cheek muscles pull up. So the best thing to do, if you conquer the ones that pull down, then these take over, and they do end up filling the hollow here a lot of times.
Yeah.
They do. And they're the depressor action of the muscles it's constant. The only time actually it's not pulling down is when you're talking.
Yeah.
Yeah, so it's a constant pull down. So relaxing that muscle, imagine it's pulling down all day long and you relax it, you do get a pretty nice spring back.
Yes.
I will say once people do the Nefertiti, they don't go back.
No, I know. It's like
No.
part of
Once
my
someone
whole
allows
thing.
you to try it once, it's
Yeah.
part of the routine forever.
Yes.
Not that it has to be, but you just like it so much that
It's-
you want it to be.
Yeah. It's the same too with like masseter toxin, somebody that has TMJ that's never had relief or has had relief in years, and you tox the masseter that's clenching constantly, they're like, oh my God, I didn't know this is what normal people felt. Yeah. Same concept. Or like her with the traps. I do a lot of like newer moms that have been carrying their baby around for the past year and didn't realize like one side's like this big.
Yeah.
And you tox them and they're like, oh my God.
It makes a huge difference.
Mm-hmm.
Yeah, and people think will I be able to move my arms? I don't even notice it until I'm realizing, wow, I'm really relaxed. Because I used to have to tell myself, pull your shoulders down. And now they just are down.
Yeah. So what are some other things that we can do with Botox?
Oh, I have one. Oh, go ahead.
Go ahead.
Well, one I was thinking about as we were talking is, like, yes, people like doing the crow's feet because it gets rid of the wrinkles around the eyes. But what I find is that when a patient smiles before getting crow's feet and then smiles after doing crow's feet, their eyes are so much more open.
Yeah.
They're like lifted and open, so when you smile, it's not like this, you know?
Yeah.
Right.
That's because the muscle around the eye is a sphincter muscle, so it actually... Sphincter.
I'm German.
I am German. My last name's Frender.
Oh, thank you.
So
I didn't know.
My last name's German, too.
Yeah. So the sphincter muscle actually has both abilities of a levator and a depressor muscle. So when you relax both, you get this widening because this portion of your orbic oculi muscle is actually probably most likely depressing, and this is most likely levating. So when you relax it both, you get this nice wide open eye, and it looks pretty.
Sphincter muscles are really unique. Like when we were learning anatomy back in the day.
We know what you're all thinking.
We only have 3. We have eye, mouth, and the
And you know
rest.
what?
Yeah.
Oh my God.
They all work the same.
Yeah.
But back in the day when we're studying anatomy and the way muscles move, like before we even touch somebody with a needle, you're like drawing lines, right? Like this muscle goes up, this goes down. Well, the sphincter is unique because the lines are all going in different directions.
Yeah.
They're like a little donut.
Yeah, and everybody's eyes are different. There's some people that are great candidates to bring the tox beneath their eye. There's some people that I would never do that on. So again, it's an in-depth consultation.
Yeah.
Allergies play a big role in doing anyone's crow's feet. Lid laxity plays a big role.
Where their pupil sits, like where the white of the eye is in relation to the pupil.
Any sort of like known ptosis plays a role. All sorts of things.
Also,
play
something
roles.
fun you can do under the eyes is you can dilute the Botox a little bit, or a lot actually, dilute it a lot, and then do little tiny micro injections under the skin. So it's not affecting the muscles under the eye, but it just helps with the skin crepiness. It's beautiful.
So you're all
Makes your
squeezing out.
concealer lay perfectly.
Yeah.
You can take that down too and tox basically anywhere on your face with a very diluted neurotoxin. And it works to shrink pores and reduce sebum production.
Oh,
So
yes.
you're way less
Microneedling
oily.
it.
Yeah.
And acne scars.
I love to microneedle it. I feel like anytime a patient comes in for microneedling, I'm like, please just let me do a little bit of Botox, microneedled into the nose and the T-zone. And people are always like so amazed because it just gives you glass skin.
It
does
does.
give
It's
you
beautiful.
glass skin.
Speaking of the nose, you can also do Botox in your nose.
yes.
You can prevent nasal flaring, so it kind of shrinks the width of your nose. You can place it in the beneath the tip to lift your nose. You can place it in your tip to also shrink the nose. You can do your bunny lines.
Dare we show them the video of you getting yours done?
No.
That was
I do
fun.
get mine done though by this one.
Yes, by this one.
It's not the most comfortable spot to get it, but it's 2 seconds.
It's easier than a nose job.
Yeah, I've had that too though.
And you guys are forgetting another fun one that you probably need.
Oh yeah, you can use it for sweating. So I like to tell all my brides or people that are in weddings, especially during the summer months, you can put Botox in either your armpits, your hands. I think people do feet. I've never done a foot, but you can do it. And it limits the amount of sweat production.
Right, because it stops the contractions of the sweat glands.
Yeah.
Yeah. The more
There's
you
all
know.
kinds of
Yeah, and it
things that you
really
can
does
do.
contract the pores. Like there's certain treatments that we can do that will actually like help shrink the pores, like microneedling and lasers, chemical peels. Botox doesn't actually shrink it for good. It temporarily contracts it inwards.
Yeah.
So it's somewhat of a Band-Aid fix, but who cares because it looks amazing, right? I mean,
Who cares?
for the 3 months that it's working, it looks great.
Yeah.
Yeah.
Okay, well, is there anything else?
I feel like we covered all
We
of
covered
all the things
all
I
of
was
it.
excited about.
Yeah, me too.
Yeah. I think at your next appointment, whether it's with us or somebody else, ask some questions about Botox because there's a lot more that this little wonderful medication can do than a lot of people know.
Yes.
Something I'd like to say about it actually though is I think for people who are nervous or they're first timers, it's non-invasive. I mean, it's very tiny needles. It's a quick procedure and it only lasts so long. So if you want to try
That's a
something
good
new,
part. If you hate it,
it
it'll
lasts
go
3 to
away.
5 months
Yeah.
and it will go away. Whereas some of other things you do are more permanent. So it's always okay to try something new with Botox because it's not permanent.
Right.
Absolutely.
The prevention that you are doing with it is permanent, which is great. But yeah, if you don't like something, it's not a big deal. It'll wear off.
It'll go
Yeah,
away.
and there's not really downtime. I mean, you have
No.
about 24 hours with a couple restrictions, like no working out,
No laying flat.
no laying flat, no
No
hot tubs, no
sauna.
saunas. But
Yeah.
anybody can go without all that stuff for at least a day.
Yeah.
Yeah, or work out before your appointment.
And I will say 95% of the time you won't bruise because we all are very delicate.
It's all very good.
Delicate.
Yeah.
Okay.
All right. Well, we'll see you guys next time.
See
Yeah.
you next time.
Bring questions at your next Tox appointment.
Yes.
Mm.
I did peace sign.
It's okay.
Well, I blew a kiss. It's fine.